I'm Ed Clark. I'm president and co-founder of the Wildlife Center of Virginia. We are one of the nation's leading teaching and research hospitals for wildlife and conservation medicine. And like people across our country, we're struggling to cope with the COVID-19 pandemic and all the new realities it has imposed upon us. But specifically within the wildlife care community, or the animal care community more broadly, we're struggling to continue to provide essential services to injured and orphaned wildlife, while at the same time protecting our staff from unnecessary exposure to individuals or surfaces or materials which could carry the COVID-19 virus. Now, some of the easy things we did is we allowed all people who can work at home to work at home, and in fact, we mandate that. So while I'm president of the organization, I'm not deemed an essential person to spend time in our office, and as you can see, I'm working from home. But even within our animal care team, we've divided our staff into two care teams that work different shifts and are not allowed to interact with one another. So if someone should come down with a virus, heaven forbid, we will be able to quarantine one team while the other team holds down the fort and keeps things together. But one other thing we have done recently we would like to share with you and would like to recommend to our wildlife care colleagues nationwide is we have worked with both our state and federal wildlife agencies to get special permission to work from home while still providing animal care. Now, ordinarily under our permits, we are required to maintain all of our patients, the injured and orphaned wildlife entrusted to our care, at our place of business, in our wildlife center. But the truth is, for healthy orphaned animals, that's not medically necessary. At the Wildlife Center of Virginia, we're a state-of-the-art veterinary hospital. But these healthy baby animals just need feeding and just need nurturing. They don't need veterinary care. Working with our director of the Virginia Department of Game and Inland Fisheries, we presented our case to him that even though our permit originally stated we were not allowed to care for animals off-site in any location that had not been inspected, given the extraordinary circumstances under which we're working, the determination was made that we can safely send healthy orphaned animals home with our volunteers, with our students, or with our staff, where they can get the care they need by trained and competent individuals for which the Wildlife Center of Virginia is still responsible, but we can do it in a way that allows us to keep our staff separate and minimize the interaction our professionals have to have with one another or with our students. Now, that executive order was issued on March 20th of 2020 by the Virginia Department of Game and Inland Fisheries, an emergency executive order granting that special permission until the order is rescinded and the pandemic is behind us. That same day, we approached the U.S. Fish and Wildlife Service Office of Migratory Bird Permits, requesting similar authorization for them for the care of healthy orphaned birds. Now, we were specifically looking for the permission to care for songbirds at home, not raptors, not the big water birds, not birds that are medical cases, but the little birds that really just require the nutritious feeding every 20 minutes or so, or whatever the species demands, not medical intervention. And it took the feds a little longer, but eventually the U.S. Fish and Wildlife Service did issue authorization for federal permittees who requested to be able to send healthy migratory bird babies home with people who are listed as sub-permittees, which would include staff, students, and volunteers. Now, this has dramatically shortened the amount of time these animals must remain in our nursery, the one room where all of our baby animals are kept at the Wildlife Center of Virginia. Most other centers also care for their babies in a single room, and when staff or volunteers are in there feeding them, they're working elbow to elbow. By being able to take these birds home, our staff can now insulate themselves from that unavoidable contact, care for these animals in their own homes, and do so safely, both for the animals in their care and for the staff providing that care. So we're encouraging our colleagues nationwide to approach their state wildlife agency, most of whom are operating under state executive orders to minimize the interaction between people and to maximize the social distancing, which is all the power and authority they need to grant these special permissions to wildlife rehabilitation centers and even to home-based wildlife rehabilitation efforts. So with a little bit of effort, a little bit of cooperation between our wildlife care community and our respective state and federal regulatory agencies, we can continue providing essential services to injured and orphaned wildlife while minimizing the social interaction we are forced to have. Social distancing is good for us, and when properly done, it's also good for the wildlife for which we care.